you can't achieve ejaculation, or it's difficult to achieve ejaculation, or it feels delayed. So what do you do then? Let's get into it. Premature ejaculation, or coming too fast, is very, very common among penis owners. But the opposite problem can happen too, and that can be just as distressing. When you can't achieve ejaculation, or it's difficult to achieve ejaculation, or it feels delayed. So what do you do then? Let's get into it. If you're having difficulty or delayed ejaculation, i.e. it's difficult to come, ask yourself these questions. 1, do you have difficulty during self-stimulation or masturbation, or is it just during partnered intercourse or sex? If it's just during partnered sex, then there are a lot of factors that could be involved, revolving you, your relationship with partnered sex, your partner, and all of those things that need to be explored. Number 2, what medications are you on? What's in your medicine cabinet? Are you on an SSRI for depression? Are you on a beta blocker for high blood pressure? Are you on a mood stabilizer for bipolar disease, schizophrenia? All of these meds can cause delayed ejaculation. In fact, SSRIs, which are very commonly prescribed in medicine, are the number 1 most common medicine cause. Number 3, could you be drinking a bit too much alcohol, or do you dabble in recreational drugs? Alcohol use, cocaine, heroin are known to make achieving orgasm harder. So if this sounds like you, chances are that's the culprit, and you need to address those behaviors first. 4, have you lost sensitivity in your penis? How is your sensation? Is the sensation normal, or does it feel decreased? Sensitivity can decrease with nerve damage. This can be caused from previous surgery, particularly in the pelvis or genitalia, or neurologic problems, for instance, spinal cord injury. If sensitivity is leading to a decreased enjoyment, that could be why ejaculation and achieving orgasm is so difficult. And ask about your arousal in the first place. People confuse arousal, erections, ejaculation, but arousal is the first thing. What gets us stimulated? Okay, you need arousal generally first to get an erection. Getting an erection is completely independent of being able to orgasm or ejaculate. So patients who have difficulty or delayed ejaculation oftentimes don't have any issues with erections, but there's something, whether it's one of the things I've described earlier, there's something that's kind of blocking and impeding them from achieving orgasm and ejaculating. So now that you've asked all these questions and you've thought about the answers, what can you do about it? Well, 1, if a medication is potentially the problem, try to see and talk to your doctor, your prescriber first. Do not stop a medication without your doctor's permission or your prescriber's permission. But see and talk to your doctor who's prescribing it. Hey, can we switch medications? Is there a possibility I can get off this medication? Can I try a different type of medication for this issue? One that is not notorious for causing ejaculatory or delayed ejaculation issues. 2, therapy. Most people with delayed ejaculation are probably ripe to receive psychotherapy. And when we say therapy, people naturally get defensive. They think, oh my gosh, my doctor's not listening to me. They think it's all in my head. That is not the case at all. In fact, if we're recommending therapy, that's because we really want to take a holistic approach to treating you. And a lot of us potentially have some underlying issues around physical intimacy. Sex therapists can address issues with arousal, orgasm, intimacy, interpersonal relationships, previous trauma, all of these things that could be impeding you from enjoying the orgasm. Number 3, increase penile sensitivity with vibrators. Y'all know I love vibrators. The reason I love them is because they enhance the sensation. Vibrators can be used for penis owners. There are vibrating cock rings or penis rings. There are dual vibrators for you and your partner who's on the other end of that penetration to use together to enjoy and increase genital sensitivity. Number 4, try abstaining from masturbation and porn for a time. This can reduce the threshold you need to get off if you will, okay? And so try cutting off that Pornhub for a little bit and see what happens. And number 5, increase foreplay. Spend more time with physical intimacy that does not include your penis. Explore your partner more and have them focus on your other erogenous zones. There's lips, the back of the neck, ears, nipples, perineum, the gooch taint area, huge erogenous zone, the scrotum. You can make this a game where the goal is not to be touched on the penis, and you use every other sense and every other part of your body to engage in that physical intimacy. And lastly, number 6, go see a urologist. See somebody like me, okay? These problems are real problems and they can greatly affect a relationship. While there is no FDA-approved medication specifically designed to make you ejaculate faster, in some cases, we can prescribe off-label medications that may improve delayed ejaculation. I hope this helped you. Let me know what you think. You're not alone if this sounds like you. Trust and believe. Give me a comment. Make sure you subscribe, hit that bell, and tell a friend to subscribe too. And join me every week right here for all things down there.